Hello, Abisola.
Hello, how are you?
Hello, I am good and such a privilege to have you here.
Yes, I'm so excited. It's such a
Yes,
privilege to
I
be
was
here.
waiting for a while, so I was just checking out the other windows and wondering about you. I didn't realize you were in. So were you waiting for a long time?
I was there for about 10 minutes or so. I thought, okay, is it my internet? Is there a problem? And then I realized
Ah,
I just wasn't let in yet. Yeah.
okay. I think it was the waiting room issue or something like that. But so glad to have
Yeah,
you.
probably.
So glad to meet
Yes.
you.
I'm
Yeah,
glad to be here.
thank you. So we are already live on social media. So let me, without any loss of time, get straight to your introduction and also to congratulate you on the award. So first on your introduction, Abisola, she is the co-founder of Agnes. She is from Nigeria. And today at the annual Women Economic Forum 2021, she will be conferred upon the award of the Exceptional Leader of Excellence. So I'm so proud to meet you. I am so sure that you are creating such an impact with your work. And the stage is all yours. The topic for today for you would be the rise of intelligent technologies. And this,
Yes.
of course, gets a whole lot of meaning, especially now over the last 18 to 20 months, we have seen a revolution, and we look forward to hear more from you. Abisola, over to you.
Thank you so much, Sinjini. I really appreciate the opportunity and thank you for the award. What an honor. But without further ado, so I'm Abby Sola and I'm an engineer and I'm a mother of two. And just a little bit about me before I talk more about intelligence systems and the impact that it can have. A few years ago, when I had my child, she couldn't breathe, and it was the longest week of my life. I thought I was going to lose her. But in that week, thankfully, she made it. But in the same week, a friend of mine whose child presented the same symptoms died, and that just sent me down a spiral because that could have been me. And because I have a background in engineering, most of my career I spent at Medtronic, which is one of the largest medical device companies in the US. I started looking for ways that technology could solve maternal health problems and also neonatal health problems, because I don't know if people know this, but over 2 million babies die every year around the world. Close to 50% of those babies are dying in Africa. Actually, a lot of African countries and India share a lot of the burden for maternal death and neonatal death around the world. So I made it my mission to see how we could use technology to solve this problem. And today it's so apt that I'm talking about the rise of intelligent systems, because as we've seen over the past 18 months, technology, artificial intelligence has really become the fore of how we communicate, how we transport, how we make payments. It's really transforming our realities today and even into the future. And the question is, how can we use all this advancement in technology to solve some of the toughest problems that we have at scale, especially for people who may not have as much access to technology, or who may live in rural areas. And so today I'm going to share a little bit about what we've done at Agnes Health and how we are using technology and how we see technology and intelligent systems playing a role in solving some of the toughest problems we have, such as health disparities. So, as I researched the issue of maternal death in Africa, one thing that I noticed was, for example, in Nigeria, which has the second highest rate of maternal and neonatal deaths in the world, is that only 33% of women in Nigeria choose to have their baby in a clinic. So just hold on to that thought. And then as you research more about maternal deaths around the world, you find that if a woman is not attended to by a trained birth attendant, whether at home or in a clinic, if she has any complications, she's not able to get the support she needs, and she faces a higher probability of dying during the delivery. So then my team and I posed the question: how do we get more women to either demand for or desire to have a trained birth attendant at their delivery? And how can technology help support this? And so what we realized is that many of these women, on talking to them, that many of them did not know how to navigate the health system. Many of them did not even know how to what to do if they were pregnant. They didn't realize that they had to sign up for antenatal care. So we thought, why don't we educate them and help them understand the need for it? So we first did this without technology, and we realized that the women started to show more interest. And we first actually, then we went and built an app that delivered health education in their native languages, because we realized that language can be a barrier. A lot of the technology and the apps that we use today are written in English. There's a big assumption that most of the users are able to read. However, almost 67% of the women in Africa are not literate. So we created a solution that uses audio technology to provide health education based on the stage of pregnancy that a woman is. Leveraging artificial intelligence, this means that that every woman gets just the right amount of education she needs about her particular week of pregnancy that she can apply in that moment. In addition, she has 24/7 access to reach a midwife. As today, she's reaching actual midwives 24/7. But with artificial intelligence in the future, we'll be able to triage her issues instantly without even having to wait to get on a call with a midwife. And that could potentially increase our scale. So with these little improvements, with this evolution of technology, we're able to apply them to really help these women. And so what's been the impact so far? In the past year, we've supported over 1,000 women in close to 60 communities. And we've seen that on Agnes, when they're supported by Agnes, they're 4 times more likely to survive the pregnancy and postnatal period than without Agnes. And their babies are 30 times more likely to survive the newborn period, which is the first month post-birth. And so we just found that we just applying these intelligent systems of knowing what kind of education to supply to a woman based on where she is in pregnancy, we were able to make such a difference in their lives. So I know that there's a lot of concern around so much technology and privacy. And as long as we make sure that we're using technology for good and we're protecting the people that we serve, I put it to you that these intelligent systems can really help solve some of the toughest problems we face in the world. And people ask, why does maternal mortality matter so much? According to a study conducted by Harvard, if a woman dies during pregnancy, her family is more likely to spend another cycle in poverty. So this means that if we keep our mothers alive, then they have a better chance of being able to contribute to the education of their children and to be able to provide for the upkeep of the child, which then gives them a better chance of coming out of poverty. So these problems are more intersectional and multi-sectoral in nature. And with technology and intelligent systems, we can really make a difference. So far with Agnes, yes, I just said we've supported over 1,000 women. Over the next year, we plan to reach 200,000 women, and we will be raising about $1 million over the next 12 months to be able to make that happen. So yes, with that, that is how we see technology and intelligent systems really making a difference in maternal health, and not only in maternal health, right? Today, you were able to make payments without making contact. We're able, especially now when you have so many diseases out there, there's COVID-19, and we don't know what's around the corner in the future. And with technology, we're able to continue working. We're able to keep being productive in spite of all these things that are happening in our world today. So it's important that as women, we embrace technology. We understand how it can make a difference in our lives and in the lives of our communities and those we hope to impact, so that we can truly make a difference. And we all know that when women engage with a new way of doing things, we're truly able to make a difference. It's especially in technology that tends to be so male dominated. This for me is a call to all women out there to open up their minds to being able to apply intelligent systems to whatever solutions they have for the world.
Thank you so much for that very inspiring and very insightful talk. And especially as you talk about technology, medical science and women, I believe that there's so much to dig. Even staying up and talking about it the whole night wouldn't be enough. Women have been systematically been not considered in design, in technology, and
Correct.
especially as you bring in the
Correct.
question of maternity and maternal health and postpartum, prepartum, and newborn neonatal health. So thank you
Yes.
personally from a mom to a mom for bringing that very important issue on the center
Thank you.
stage. Yeah. So I really admire
Thank you
what
so
you
much.
just said. I would check up your work. I would love to know more about
Yes,
how and
please.
what you do it. Let's connect on LinkedIn, and
I would love to connect.
Absolutely. And
We
here's
will.
one more time a big hand to you for
All right,
winning
take
the
care.
award and for bringing the very, very
Thank
important topic of
you.
maternal health on the table for the annual Women Economic Forum 2021. Thank you, Abisola. Thank you.